Hey everyone, we want to welcome you out to the podcast today. We are so blessed because we get to hear from Dr. Heather Seay. She is a doctor of acupuncture and Chinese medicine, and she deals a lot with women's health and fertility issues. And there is so many women that are struggling with this. And so we are very blessed to be able to have your wisdom on here and be able to share with us, these issues that women are dealing with, that we strive to be this mother, but yet there's a lot of fertility issues that we have. And so can you kind of tell us about you and what you do and your journey and how you got here?
Okay, thanks for having me on. I'm excited to be here today. Like Liz said, I'm a doctor of acupuncture and Chinese medicine. I'm also a fellow of the American Board of Oriental Reproductive Medicine. And that's just an organization that provides advanced training for different types of practitioners in reproductive medicine. So it's the Western and the Eastern side. So we're kind of the bridge between like reproductive endocrinologists and ourselves. So we're an advocate for our patients. So yeah, I've been
just to be
fellow.
clear, let's make sure so people don't think that you just went to a weekend course to get your doctor of acupuncture. Just kind of go through a little bit. It's a real thing. I mean, you put time and effort. So kind of just a little bit about that.
So the doctorate is an additional 2 to 3 years of education on top of a master's. So it's about 7 years of education to become a doctor of acupuncture and Chinese medicine.
And are those together? Do you, like, if you become a doctor of acupuncture, you are a doctor of Chinese medicine? I mean, are they simultaneous? Are they together?
No, you can either be a doctor of acupuncture, you can be a doctor of acupuncture and Chinese medicine. Certain states in the country only allow for just acupuncture. New York being one of them. They have to do an additional training to be able to do herbs and that kind of thing. And that's the Chinese medicine side of it.
So here in Utah, you have to have licensure and all that kind of stuff to be able to do what you do?
Right. Yeah. We're a licensed profession.
Gotcha.
In most
I just
states,
wanted people to realize it's a legit thing.
Yeah. Yeah.
So you say that you help with the infertility. Let's kind of dive into that and figure more about like how you can help people with fertility issues.
Okay. So a lot of people are obviously struggling with fertility issues. And the way that we can help them, acupuncture itself will increase circulation to the uterus and the ovaries and, all the genitalia and the organs in the pelvic area. It'll also help to balance out hormones. So a lot of times infertility issues is an ovulation issue, at least in females. So we're helping to balance out those hormones that are involved with ovulation.
Can you briefly just explain acupuncture in a nutshell? I mean, I think most people understand the concept, but they don't understand why putting a needle, here will affect this organ there or whatever. Just really quickly, if you would.
Okay. Acupuncture is a technique within the whole system healthcare of Chinese medicine. And there are points all over the body, and they are along what we call meridians, which are just energetic pathways. And those meridians will, we have energy everywhere. That's how our bodies run. So the meridians will contact the internal organs as well. So we can affect those areas by choosing certain points on different pathways. Mm-hmm. And so the way that we determine—
And putting in the needle stimulates that pathway. Is that
right? Putting the needle in will either what we call tonify, which boosts the energy in that pathway, or we reduce, which means there's just too much, or sometimes there's a blockage where the circulation cannot get through. And so we'll open it up with certain points. Each point has different functions. So we just choose them based off of that.
So when somebody comes in to your practice, like what are some things that they've been dealing with? I know fertility, but are there different ways that you can help educate them and to be able to help them have a better opportunity to get pregnant? Like, you know, like what about the eggs and how can you improve your egg quality? And do you do that through the acupuncture, or is that more of just an education things that they can do?
We can definitely do both. Education is a big thing for me because a lot of people just aren't educated on how their bodies work or how they can improve their health in different ways. And a lot of times preconception health is like a big deal.
So is that what you focus on a lot, is preconception stuff?
I mean, it would be my wish for everybody to come in to see someone like myself or, you know, even other natural healthcare practitioners prior to trying to get pregnant. Because if we can work on these issues, you know, 3 to 6 months before they actually try or before they decide to do IVF, then they're in a better place. They're going to get better outcome.
Save them lots of money too.
Yeah.
IVF is not cheap, you know.
Yeah,
I mean, they're spending 10, 15 grand a pop, right?
Yeah. And it's a rigorous process. And a lot of my patients that are going through it, they are just stuck in this stress loop. And that does not serve the process. So if we can get their bodies to be functioning in the parasympathetic prior to doing IVF, they will have a much better time. So that would be my wish for everybody to do.
Okay, so for those people
stuff
that don't come in, because most people, you're like looking at that's probably only 5% that actually think about it probably ahead of time, right?
Yeah.
They come in because it hasn't worked, not because they want it to work better.
Right.
So
yeah, we can still help them. Obviously, that's probably a good majority of my patient base is they're coming in, either they've been trying for 6 months to a year or even longer, or they are just about to start their IVF cycle. So we'll start to, you know, improve their system, you know, get things moving in the right direction so that their outcome is better. But a lot of times they're not told that most times first time IVF cycles do not work. So they really should be told that, but most times they aren't. So
why tell someone when you know you're going to get another 15 grand? So that's a $30,000 machine right there, right? Kind of sad, right? So yeah. What are the biggest myths that you see about people have about fertility and the causes of infertility?
A big one is that it's just a female issue. Like half have a male factor involved. So the men should really be looked into more often than they are. A lot of times they'll just get one semen analysis and they go off of the World Health Organization's, you know, parameters for sperm count and morphology and things like that.
Right.
But they aren't told that, you know, they should probably get another semen analysis or they should get DNA fragmentation done. And that's not really done in this country very often. Europe is like way ahead of us as far as that goes. So that's a big one.
So when you talk, let's kind of go through that just really quick for the people that aren't really and don't really know this field. When you talk about a semen analysis, what are they looking for?
They're looking for total sperm count, and then they're looking for the amount of sperm that have a misshape or an abnormal shape. Mm-hmm. They're looking for the motility, so how well they move. And then, like I was saying,
if they're good swimmers or not, and if they're
right,
and if they're the way they're supposed to be, basically.
Yeah. And then I think they should add on DNA fragmentation, which just means, is the DNA intact? And how many of the sperm actually have their DNA intact?
So that is a problem. I'm not aware of that. So there's a problem with the proper DNA sequencing in individual sperm.
Right.
Okay.
Yeah. And it's becoming more of an issue, just like most fertility problems are becoming more of an issue.
Mm-hmm.
So what have you noticed are the biggest struggles that people are dealing with fertility?
Like I was mentioning, like being stuck in the stress loop, or kind of being stuck in, a lot of times they'll go through like self-doubt, self-sabotage, and second guessing whether their bodies can actually do this or not.
Mm-hmm.
So they kind of get stuck in that mindset. And when someone is stuck in a stress loop, their bodies are not able to procreate because they're stuck in the sympathetic nervous system cycle. So their bodies are pumping out cortisol, which are our stress hormones.
Right.
And naturally, the body does not feel safe enough to procreate. So a lot of the work that I do is trying to shift them out of sympathetic into parasympathetic so their bodies feel safe enough.
Do you feel also like birth control and things like that are keeping people from not being able to later on having fertility issues? The reason why I say that is because, I was on it for a short amount of time, got off of it after like a year, but then it was like 2 years later, we tried to have a child and it took us a whole year. Now, I kind of feel that it was that moment where the stress of, not getting pregnant every month. And I was in the doctor's office, just asking them about fertility things, going to the next step.
Mm-hmm.
And I just was like, I need to get to the point of it doesn't really matter. And there's always that option of adopting. And so I just walked out of that office thinking, I don't really want to progress that. Well, it was the next month that we ended up getting pregnant.
Which seems to happen, right? People, they try and try. They finally adopt a kid, and all of a sudden the next month they get pregnant, right? Because it's like that stress got taken off or something. I mean, it just seems kind of.
I just didn't know, like, if you have seen like birth control, things like that are hindering you to be able to get pregnant later on, and then adding the stress on top of that, or if it's just, it's just our normal cycles that we go through too.
No, I definitely think that the various birth control methods, they take over, and they're the ones, handling the hormones because it's synthetic.
Right.
So the body just kind of shuts down that process. So, I mean, oftentimes people are told that when they get off, it'll come back immediately, and they should be able to get pregnant.
Several months before they should even try to get pregnant, right?
Right. Yeah. They should definitely, if they are on birth control and they want to have a child, they should get off of it as soon as they can, just so their body can start to regulate itself.
And it's kind of like a detoxification process that your body has to go through. And I don't know if it was the stress in my life that was causing me not to get pregnant, or if it was that my body needed to detoxify more. But this was, we tried 2 years after I got off birth control, and it was still, I feel, affecting me.
Well, we started like when we first got married, right? And then I went to chiropractic school. So then we started realizing, oh, maybe we shouldn't be doing these things, medications. So that's when we got off and all that kind of stuff. But I do have a question for you. This wasn't one that we had kind of thought about. But if someone is doing birth control, what would you say is the best form of doing that? So that, that is, if you want to say, that's going to not cause problems down the road, like IUD, that's going to cause problems, birth control pills, what do you counsel your patients?
I would say the fertility awareness method is probably the best way to go, because then you don't have to use anything. You're just tracking the woman's tracking her cycle, and aware of how her body works. So I would say that would probably be the best way.
And a lot of times people think, oh no, that's too much. But actually that we were on birth control the first year. And after that, after we got married, after that, that's basically what we did. Mm-hmm. And now we do have 6 kids. So that's not fair.
They are 3 years apart, so they're planned.
Everything was planned. After our first one, it was like everything else was planned, basically. So
yeah, I mean, there's a definite learning curve to the fertility awareness method, and it's not the same as the rhythm method. So I definitely want to dispel that.
Yeah, so take 2 seconds and explain that then, because that's what I think you were meaning.
No, I mean, the rhythm method is really a Catholic religion kind of thing, where they put that out to, help people
not
have to use birth control, right, basically. Right. But the fertility awareness method, you're tracking certain signs. So you're tracking the cervical fluid. You're tracking, sometimes you can track the cervical position, and you're tracking your basal body temperature. Mm-hmm. So a woman's cycle goes through different phases. Right. There's the follicular phase, which is the first half, and then ovulation, and then the second half is the luteal phase. And so the temperatures will change based off of the phase of the cycle, and cervical fluid will change as well. So if they are tracking these things, then they can, like I said, understand how their body works and when their fertile window is. And so either if they're trying to avoid pregnancy, they just abstain when they're in their fertile window. And if they're trying to achieve pregnancy, obviously they have intercourse during their fertile window.
Okay. So what do you think is the biggest myths about the causes of fertility?
Or what are the biggest myths?
I mentioned one of them, that men are not, really looked into. Also, a lot of people believe that their fertility just drops off a cliff after the age of 35. And that's really not true. There are plenty of people that I know that have had children after 35 and even into their 40s. So the way that our eggs age is different than our chronological age. So that's just a myth. Like, it's just not true. Plenty of women can get pregnant after the age of 35.
There's plenty of people that have that little caboose that's like 8 years later. They're like, oh, didn't realize everything still worked.
Yep. Another one is anti-Mullerian hormone, which is another hormone that our body produces, is a fertility test. And really the only thing that it's doing is seeing how many baby eggs you may have. But it's just not a fertility test. It doesn't tell you like the quality of your eggs. It just tells you how many you have in your basket, basically. So a lot of people will kind of focus in on that number and worry about their follicle count, which is just their, initial like eggs. So yeah, I want a lot of people to know that that's just not a fertility test.
So what is it that you do if someone's coming to you that kind of makes you different in the way that you do it through either acupuncture, Chinese medicine, combination of both? What is it that when someone comes into you that they can expect, and why what you're doing can be more beneficial?
So I have a program that I put most people through. It's called the Fertility Growth Method. And we do a thorough intake, complete health history of where they've been and where they're at and where they want to go. And then we do a little bit of genetic testing, because some things can affect the way that someone is able to get pregnant based off of their genes.
Like different SNP issues, is that what you're referring to?
Yeah, different SNP issues, yeah. In the way that...
Are there any specific ones that are the big ones, bad boys?
Some of the ways that people methylate or detoxify can affect their ability to get pregnant. And some SNPs will show whether you may be prone to what's called endometriosis, which is that tissue from the uterine lining grows in other areas that it shouldn't.
Right.
So some SNPs will show whether they may be prone to that. And then we'll do a little bit of hormone testing, and I use the Dutch Hormone Test, which is
Love that test.
dried urine for comprehensive hormones.
Yeah, I just tell people it's a test.
Yeah. Really easy to take. And they just send it in, and the lab will analyze it, and we'll be able to see where their estrogen and progesterone levels are.
As well as other hormones too.
And then I'll take them through the program after we've done the initial, workup. And we first start by, if there is a menstrual cycle issue, either irregular menstruation, lack of menstruation, any type of issue, any PMS, we'll work to balance that out first and get rid of the PMS, because I've seen that when people get close as they can to an ideal cycle, which is a 28 to 30 day cycle, ovulating around day 14, have plenty of cervical fluid, the fertile cervical fluid, which is the egg white consistency or the stretchy cervical fluid. And their luteal phase is long enough, which it should be, 12 to 14 days, to allow time for the embryo to implant and, burrow into the lining. They get pregnant naturally. The closest they can get to that, they will get pregnant naturally. So we work on the menstrual cycle first. And then if there are any other issues, male factor or egg quality or a digestion issue, because the microbiome will kind of affect the vaginal microbiome. So things will get thrown off there. We'll just balance everything out after we've fixed the menstrual cycle issue.
So what do you think is the biggest mistakes that people struggle with when they're trying when they're having fertility challenges?
When they're initially told that they may have some problems getting pregnant, or they think they might, they feel pretty healthy, but they think they might have problems, then they start looking on Google for anything and everything that will help them. But it's not individualized. It's not based off of, what their actual body is doing. It's just general advice. And they'll start following that, and it kind of wastes time and money.
If I take this product, it will help.
Yep. Yeah. Or they'll hear stories from their family and friends about what other people did. And it's just not based off of, their own individual situation. So that's a big mistake people make, because it just wastes time and money when they could just be really focusing on what their actual body is doing and why they're having an issue. They don't prepare themselves prior to wanting to conceive. So they just think that, most people are told that a woman can get pregnant any day of her cycle. So most people don't know that there's really only 5 days of a cycle.
Do you really have people that come in and think that? Did they not have basic anatomy in high school?
They don't get it. They don't get it in high school education. So they don't understand that there's really only 5 days of a woman's cycle, maybe 7. that
now
they
that
can
that
actually
does get
conceive.
screwed up when a woman's cycle is not regular, for sure.
Right.
Because
Yeah.
you don't know when those 5 days are, right? But
Yeah.
that's I'm surprised that most women don't realize that, or not. I shouldn't say most women, that some women wouldn't understand that.
Yeah.
Basic 101 female understanding of their cycle.
Yeah. I mean, it's going back to not understanding really how their body works, which isn't their fault. I mean, they just weren't ever told.
Mm-hmm.
Yeah. And we all have a process of learning.
Mm-hmm. Yep.
So,
and then another one is people, they're either told that IVF is their only option, or they rush into it too soon. And then
I kind of feel like that's what was me with my situation, is like, I'm still young. And I just, all of a sudden I was like at the doctor's office of, I'm not getting pregnant, but it had only been a year, so.
And, we were working lots of jobs. I was in chiropractic school. We were managing apartments. I mean, it was, it was kind of a stressful time and everything, right?
Yeah.
So I have a question for you. This is completely off of topic. What have you seen with this whole COVID thing, either vaccine, non-vaccinated, whatever, because it's now even the medical community is saying, oh, there might be some issues with cycles now because of this. What have you seen where this is your specialty, female health? What are you noticing, and what have you seen?
Yeah, initially the vaccine will throw off the cycle. I've seen that to be true. It'll just either there's period will come a little early, or it'll be a little late initially after receiving a dose of one of the vaccines. I haven't seen it affect fertility yet, but it's too early to tell, really.
Okay.
So, but yeah, it has thrown off the cycle a little bit.
What can people then, if they come to see you, how can you help them figure out then the situations that they're going through? Like, what is it that you can help them with? And what is it that they do to come see you for the process that they go through?
I can help people with ovulatory infertility, the various causes. PCOS is like the major one. Thyroid dysfunction will throw off the menstrual cycle. So I can help people with, low thyroid or even high thyroid. We can balance out
and
that.
That's a huge one. And that's really irritating that these clinics, your standard medical fertility clinics a lot of them don't even check into that.
No, or they'll just run a TSH, thyroid stimulating hormone, and it's just not that's not enough information to go off of. So I really encourage my patients to get a full thyroid panel, including antibodies, because Hashimoto's is more often.
Yep.
Yeah. So ovulatory dysfunction, menstrual cycle irregularities, or any type of menstrual cycle dysfunction, male factor, low sperm count, poor motility, poor morphology. I can't really help with like blocked fallopian tube. Most people will be pushed towards IVF if they have a blocked fallopian tube. But I have helped people with a blocked fallopian tube going through IVF get pregnant. So we'll optimize, the IVF cycle and get them to a good place. And when somebody's going through an IVF cycle, they'll come in to see me once a week throughout the cycle. And then on the day of embryo transfer, they usually come in twice. So prior to embryo transfer and after.
Oh, okay.
And then I can help people in early pregnancy and throughout their pregnancy. Egg quality issues, sperm quality issues. We can do something about fibroids and endometriosis. So, I mean, most things that have to do with infertility, other than a blocked fallopian tube,
what kind of things are you doing for the men? So if their sperm is not proper morphology and things of that nature, there's things that can be done for that?
Right. Yeah. So a lot of times it's an energy production issue or an ATP production issue. So we can help with some of our herbs, like
Okay.
Chinese daughter seed will help increase ATP in the egg cell and the sperm cell.
So Chinese daughter's seed will help the male seed.
Yeah. Yeah. As well as the egg. It just helps with, mitochondria production and ATP production. So,
okay.
Yeah, and we'll use acupuncture to, increase circulation to the pelvic area and help with sperm production.
Excellent.
Yeah. So, there's, a few people in, acupuncture stuff, but what is it that led you to be able to get in the field of fertility? Like, what was your journey to get to fertility with acupuncture and Chinese medicine?
Or was that always kind of the thing you were going to?
Yeah, I've always been interested in women's health and fertility. Like this goes back way to 1998. My husband now, my boyfriend at the time, we were starting to focus on our health after we had gone to massage therapy school. And we were really focusing on using the holistic health principles to optimize our system. And we really hadn't thought about having kids yet. But we thought we had run into family members and friends that were having issues getting pregnant, and we were just wondering why. So we started, investigating that, and shortly after we conceived our first daughter, after we had really focused on, dialing in our health. So that just really kind of fueled the fire. And then I have 3 daughters. So women's health is like a big deal to me. And I see a lot of women just being dismissed or, not heard or marginalized. And I just don't want to, perpetuate that type of thinking. And I don't want to see my daughters end up not being heard or, thinking that their issues, if they have any, are all in their head, or, there's just no Western medicine. Sometimes if there isn't any reason or they can't find any reason for something happening, they just dismiss it.
Yeah.
Yeah.
Blame it on the person. Yeah, for sure.
And I see that a lot in women's health. Like a lot of it takes 10 years to get an endometriosis diagnosis. I think that is ridiculous. So I just don't want to see that anymore. So I'm kind of out there trying to educate people.
Perfect. So how can people just give us your information on your office, and how can people get a hold of you, kind of your website, phone numbers, that kind of stuff, so we can have it on the podcast as well?
My website is easternbench.com. Mm-hmm. And the office number is 385-279-2410, where they can schedule a free consultation or an appointment.
What city are you located in?
I'm in Salt Lake City.
Okay.
On 3900 South.
Now, can I find you? Are you on Facebook or Instagram or anything like that? Or?
Yep, we have a Facebook and an Instagram. / Eastern Bench. So they can find us there. Yeah.
So I just wanted to say that fertility can be an emotional experience that a woman goes through. Mm-hmm. And it can really affect you in so many different ways. And we don't always understand what the woman is going through when they're dealing with fertility. Mm-hmm. And the one thing is that they feel like there's only one way, and that's through the medical doctor and doing the IVF, and just, this is the only way that I'm going to get pregnant. And so I just want to commend you for figuring out a different way and figuring out how women can actually tap into their body and be able to, because when you're going through the experience, it feels like you're kind of like a science experiment that these women have to go through. But you come at it with a totally different approach of tapping into your body and seeing the signs within your body and taking the herbs that are going to be helping with that, and having the acupuncture that's going to open up different energy pathways for that to happen. And so thank you for giving women a different approach and an opportunity to be able to get pregnant.
Oh, thank you. Yeah, I feel blessed and honored, and there's a lot of hand holding and, helping with the emotional side of it, which, reproductive endocrinologists don't really have time to do. And that's not really their
thing.
Forte. So we do a lot of that.
We appreciate you being on the podcast. Thanks so much for wanting to be involved and being on it. And also, she's also going to be at our conference, which is the BHU Utah Natural Health and Wellness Conference on April 22nd and 23rd. So you can come and talk with her there as well. But thanks once again for being involved, because we just want to be able to share. Our whole message is to let people know that there's answers to people's questions and health issues, and they're not necessarily where we think they are in standard medicine for sure, but there's answers out there. And so our platform is to try to give people an opportunity to find out that there's other opportunities out there, such as this one, so that they can, if they're struggling with this, they can get hold of you and at least get some answers for themselves taken care of, and maybe might even be a help from you. So thank you so much.
Yeah. Well, thanks for doing that.
Dr.
I really appreciate it. Yeah. Have a great day.
You too.